Hey guys, welcome back to part 2 of our interview with Dr. Skaggs. If you missed part 1, check it out over here, but if not, sit back and relax as we answer one of your questions. So Dr. Skaggs, we actually had a few viewers ask some questions of you, and I would like to ask them, so if you could give them some answers and insight into what you're doing. The first one is, can you give us some information about good cholesterol and RA? Do you think a poor diet increases severity and inflammation in RA?
I do, and I think that there is a lot of research that backs that up. I think that's true in autoimmune diseases and as in the general population. I think that the problem with us humans, though, I think we're a little bit more complicated, and certainly environment and genetics play huge roles in this that we just don't understand. Certainly RA, lupus as well, and most other diseases, to be honest. So my attitude personally is I try to eat as well as I can just to, because I know it's not going to hurt me to eat my fruits and vegetables, I guess.
Right. Definitely. And then another kind of question about diet. So this person said, turmeric, ginger, cinnamon are known for anti-inflammatory properties. When someone cannot consume these due to other illnesses, what can be consumed to help lower the C-reactive protein blood levels?
C-reactive protein. So as far as a lot of those spices go, they are anti-inflammatory and certainly are shown to be prevent oxidation. A lot of times, though, you'd have to be eating an awful lot of turmeric or cinnamon to be able to get those benefits. If you can't eat those sorts of things, I would, again, you try to eat as well as you can. Certainly fruits and vegetables that are going to give you antioxidants, that are going to give you all these things that you hear about in the media. It's certainly true. Just try to eat as well as possible, I think.
A lot of our viewers might not know that you are an athlete yourself. And
I don't know if I'd go that far.
well, you ran a half marathon at the Long Beach half marathon just a few months ago. Do you promote physical fitness I know you don't see patients, but how do you think that physical fitness, I guess, can maybe help these patients with these diseases?
Well, I feel that exercise is very helpful. Certainly, our group has a paper showing that exercise helps pro-inflammatory HDL turn more normal in a small set of lupus patients that are here at UCLA. It's difficult for RA and lupus patients to do that. I mean,
Yeah, totally.
And so for somebody like me to say, hey, go out and run a half marathon, that's an impossible thing to do. But I think that every little bit helps. If you can get in a pool, move around for 5 minutes, it's going to help you. And I can speak from experience that I don't want to go out and run sometimes, and it's the hardest thing is getting out the door and starting. I feel like exercise and good diet. I mean, I don't think that there's anybody that's going to tell you that those things are bad for you, and I think it helps more mentally almost than anything else most days.
Yeah,
I'm a huge fan,
great.
and I'm honored to run for Racing for a Cure.
Yeah, well, we are very happy to have you on our team for sure. So, why do you think? I mean, you have received 2 grants from ANRF. Why do you think it's important to kind of stay involved and do interviews for us and just stay in touch with the foundation?
There's multiple things I love about ANRF, but the main thing is just the personal bond that I've been able to make with Helene and you and Derek. It's been lovely, and the fact that almost all the money that you guys raise goes to funding basic research to figure out these diseases is, I think, just a fantastic thing to get involved with.
Great. Great. Well, yeah, it sounds like you're on the right path, and this is a very exciting, area of research. I mean, for me, who not knowing a lot about research, it sounds like you're onto something really great. So, I thank you for that.
That's the hope. Thank you.
And yeah, thank you very much for sitting down with us. We really appreciate it.
Sure, my pleasure.
All right. Thank you. Thanks for watching part 2 of our interview with Dr. Skaggs, and for submitting all those great questions. Make sure to subscribe to our YouTube channel, and check us out at curearthritis.org for all the great updates on the Foundation. And stay tuned next time as we interview Dr. Albani, who's researching juvenile arthritis. We'll see you next time.